Well, it depends on the treatment. For me as a surgeon, the obvious side effects are surgically related. And those can be lumped into a whole various categories. Obviously, taking out somebody's lung or a portion of their lung can put them at some respiratory challenges or difficulties. And the vast majority of patients being smokers who have been smoking for a very long time, 20, 30, 40, 50 years, often have, if not always have, some degree of emphysema. And if you've already got somebody with damaged lungs and you're taking out another portion of their lung, the lung doesn't rejuvenate, it doesn't grow new parts, it doesn't become more functional because you've made space for it. You just lose that lung function. So if you take out a lobe, which would be a standard operation, that's roughly 20% of somebody's lung function. If they've already got emphysema, that can be a significant hit to their pulmonary reserve and create great challenges in life as far as activity goes and quality of life. Same holds true for esophageal cancer. The treatment for that is to take out the esophagus, and we use the stomach to replace the esophagus. That's a big challenge. That's a big operation, and it has great implications for quality of life and eating and enjoying food and nutrition and weight and all sorts of things. Chemotherapy is a great challenge to patients. It's fundamentally a toxin that we're giving to people that, while it targets cancer cells, it also targets certain other normal cells, and so there's always a certain degree of illness associated with it. And in some patients, it can kill people and create great grief. Radiation is similarly another toxic treatment, and along the way, it takes out healthy cells and causes some other organ injury. We're getting better at targeting it with things like stereotactic radiation and other forms of radiation, but in the end, it still has the potential to injure healthy cells and cause some complications along the way. So there is no such thing as an uncomplicated cancer therapy. As we get closer to genetic modalities and targeted therapy, we may see less and less side effects and collateral damage, but for the time being, there's still a fair amount of collateral damage as we try and get rid of the cancer. Fortunately, the human body is capable of recovering from most of that, but in some cases, that's not always true.